therefore more fundable. We also provide fee-for-service as well. Our vision really has been about both network development and infrastructure development. So on the back of building strong relationships with academics and through their reputations, we built this industry consortium. And for the past 4 years, we've been looking at intellectual property from Canada and around the world, and have now built deal flow opportunities. And so now we're building a third network, an investor network, that will be able to truly fuel the system, not just prime it with some seed government money. And for the companies that we're creating and ones that we're now attracting to the system, we're really supporting that with 4 major initiatives. One is to leverage the clinical infrastructure in Ontario to drive cell therapy clinical trials. Second is to take advantage of Canada's positive regulatory environment for cell and gene therapy. The third is to tackle reimbursement, which every jurisdiction in the world is trying to figure out. And the fourth, to build manufacturing capability here at home so that the companies we create are sticky, and so that manufacturing happens here. And you may have heard that last week the Prime Minister was at CCRM to announce a major investment by the government and GE Healthcare in a manufacturing technology development center at CCRM. So CCRM takes intellectual property and problems, and we have a number of business units: build, evaluates technologies, and does consulting, and packages technologies into new companies. Advance our in-house facilities that can do diligence on technologies and co-development projects with industry. Bridge is the new GE Center, which is this manufacturing-focused development center, and there's Prime Minister Trudeau in our lab last week. We're with the University Health Network. We're building a GMP facility to provide clinical trials, or cells for clinical trials. And launch at CCRM is a fund that we hope to launch later in the year to finance regenerative medicine companies in this rich ecosystem that is built around our scientific excellence and now our commercialization model. So our 3 networks and specialized funding, people, and infrastructure all supporting this business model. In terms of leveraging our academic partners, these are our partners, and in the last year, the Ontario Institute for Regenerative Medicine was funded, which strengthens the discovery pipeline. Medicine by Design is a $115 million synthetic biology program that CCRM is the commercialization partner for. The Ted Rogers Center, the largest philanthropic donation, was provided to the community, and there's an RM component to that. The CCVP is the GMP facility, and we've launched with partners around the country, CellCan, which is a cooperative of GMP facilities, and Accelerex is a new venture fund that CCRM is a part of that brings together a number of CSERs. In terms of our industry consortium, and these are the members of our industry consortium, many leaders in the field, we've done many projects and announced this $40 million bridge with GE last week, and continue to engage and benefit from rich engagement with industry. So CCRM's sweet spot, and this starts to have us focus in on what we can do with Japan, is really to focus on phase 1 and phase 2 clinical trials, companies that need investment and can go through a value inflection at that stage, but also where we can conduct that manufacturing optimization scale up at the time that it should be done between phase 1 and phase 2, where it's cost effective to do it, not try to go back after a phase 3 trial or commercialization to do the scale up and optimization. And this field is a field where manufacturing and the scale up and the upstream and downstream processes are not well established yet, and where cost of goods is important to the reimbursement and also the regulatory approval in these with these projects. So CCRM is building a place for itself in this phase 1, phase 2 area with manufacturing, clinical trial, and investment focus. So we will move into Mars next year, where we will bring together our all of these initiatives, including the headquarters of OIRM and Medicine by Design. Very, very exciting, 40,000 square foot village for stem cell activity. And that takes me to looking ahead to version 2.0 and 3.0 for CCRM. I mentioned access to IP, academic and industry networks, 35 people, 25 million in initial funding, and we built a special lab to advance technologies. As we move into our next phase, we will move into Mars with this manufacturing capability. We will leverage up our funding significantly, particularly with the venture fund that we're working on, grow to 100 people, and start to build both an investor network and an entrepreneur network to move things forward. Version 3.0 is to build these important relationships with countries like Japan to truly scale and make this CCRM model sustainable. So CCRM is working with organizations in Japan and Australia and Israel to build hubs of our model around the world. And really the advantage of that is we can take the same model that we've done where people funding and facilities around critical networks and a both not-for-profit and for-profit structure to make sure that we're all talking the same language and doing things like addressing the complexity of regenerative medicine, where time is of the essence and funding is limited, where you need critical mass and scale. You can't do it as a single country or single company, where we can create synergies around intellectual property and bundling it and expertise and resources. Japan is an expert in IPS cells and in automation and industrialization, and Canada has its own expertise. Also, those hubs will enable us to access the critical markets in the world when these products come to market. And they won't come to market like the standard pharma model. They'll require partnerships with health science centers to deliver these cell therapies to patients. So if I think of Japan and Canada, Janet's going to talk about the rich scientific collaboration and the scientific excellence in both countries. In Japan, you just heard, Japan is buying up companies all over the world. I put you there as a source of funding, but also a source of exits. Very, very active investments in Japan, strong industrialization. We're going to hear about market access and regulatory approval and a gateway to Asia. On the Canadian side, we're building expertise in company creation, this bioprocessing element, and doing phase 1 pivotal trials and a gateway to North America. So to end, what's the progress to date? I'll be in Japan twice in the next 2 months. We are engaging Japanese industry, have projects with companies like Nikon. We will sign with FIRM, the Forum for Innovation in Regenerative Medicine, an industry consortium in Japan, an MOU when I'm in Japan, and talk about that a little bit later. We are visiting and signing MOUs with leading institutions in Japan, and in fact have been assessing technologies in Japan, about 40 of them over the last year. We are meeting with investors around the RMIF and are trying to organize a workshop in Japan to bring together industry, academia, and the regulators to continue these conversations. And it's wonderful that JETRO is supporting all of this both here and in Japan. So in summary, our model is all about collaboration and capital efficiency. We've demonstrated that having a coordinated commercialization platform can attract money and partners and deliver new funding and generate impact. To generate or achieve sustainability, which is what we want, we need to take a piece of the pie so that we can reinvest it. That's our model. We're not a granting agency. We're a technology-focused investor. And we want to address the complexities of this stem cell world by building a global network of like-minded hubs. And we're actively engaging those hubs in the world, and Japan is really leading that activity with us. So thank you very much for your attention. I think we're going to have questions after the next talk. But it's my great pleasure to bring up to the podium Dr. Sahgal Nishigaki, who is a research fellow at Astellas Pharma, one of Japan's leading pharmaceutical companies, focused in the regenerative medicine labs in Tsukuba City. As vice chair of its steering committee, she's also very active in Japan's lead association for the promotion of regenerative medicine, an industry-focused organization called the Forum for Innovative Regenerative Medicine. And it's really amazing to see how Japanese industry is stepping up and taking leadership in the advance of regenerative medicine in Japan. So please give a special welcome to Dr. Nishigaki, who's come all the way from Japan to explain the very bold regulatory changes in Japan. Thank you.
Thank you very much for the introduction. My name is Nishigaki from the Forum for Innovative Regenerative Medicine, or FARM. I also work at the Regenerative Medicine Research Laboratories at Astellas Pharma in Japan. Today, I will talk about the regenerative medicine market in Japan and introduce FARM activity. This is today's content. First, I would like to describe the market condition of regenerative medicine in Japan. Second, I will show the current expedited approval system in Japan. And next, I would like to introduce Forum for Innovative Regenerative Medicine, FARM, that is a main industrial association in Japan. Finally, I will introduce one of the important activity that is a partnering between Japanese companies and foreign companies for entering the Japanese market. First, I'll show you market condition of regenerative medicine in Japan. This slide shows an estimate of the market size provided by the Japan Ministry of Economy, Trade and Industry, METI. This estimation is important for companies willing to work in this area. Also, any accurate forecast is difficult. METI is clearly very optimistic regarding the global market. For example, in 2050, market growth is estimated to be about $380 billion, as shown at the right figure. The left side figure shows METI's forecast for the Japanese market, which again points to massive opportunities. $25 billion in 2050 is from 1/4 to 1/3 of the current Japanese pharmaceutical market. In Japan, it will not show growth of total medical cost, so it is estimated that the regenerative medicine market is significantly growth. This slide shows us supporting industries for regenerative medicine market. The supporting industries conclude service, for example, transplantation, consultative service, consumable supplies, and device, etc. METI has also estimated the supporting industry market. As I have mentioned, the regenerative medicine field relies not only on the support of core regenerative medicine and cell therapy companies, but supporting industry also play a crucial role. As shown in the previous slide, market growth is estimated to be $380 billion in global. This right here shows supporting industry is estimated about $150 billion. So METI has estimated the market size of supporting industries at more than 1/3 of the total regenerative medicine area. The example list is related industry of RM regenerative listed by METI. In Japan, not only by venture and pharmaceutical, but also supporting industry, that is chemical and material industry, machinery and device, supporting transportation, insurance, consulting gather together. Next, I'll introduce Expedited approval system for regenerative medicine in Japan. Why new regulatory framework was desired? Regenerative medicine desired for unmet medical needs under the present treatment, but it is difficult for evaluation since limited number of patients available for cell therapies. It is difficult to conduct controlled study to demonstrate true endpoint of clinical benefit, and heterogeneity of quality affected by source materials. So we should think outside the box for adequate new regulatory framework for expedited R&D and review for cellular and tissue-based products. This slide shows key points of Japan's two new regulatory frameworks. Japan's new regulatory framework enforced on November 2014. I'd like to explain in order. First, I explain about an establishment of a new and separate category, regenerative medicine in the framework. The previous framework consisted of only two categories, pharmaceuticals and medical devices. The new framework under the Pharmaceuticals and Medical Device Act, PMD Act, provides for a new regenerative medicine category within the existing framework. It will be estimated that the regenerative medicine is evaluated for approval in appropriate fashion. Next, I'll explain about an establishment of an expedited approval system for regenerative medicine products. This slide shows a conditional term limited approval system within the new regulatory framework in Japan. The previous approval pathway is the upper arrow. Phase 1 to 3 clinical studies are the central part. Due to the specific characteristic of regenerative medicine, the effect of treatment is highly dependent on cell-by-cell differences and is also highly dependent on the individual patient. So we will be unable to statistically demonstrate all efficacy and side effect data in advance. The new regulatory system has been established against this background as a conditional approval system. Even if we can show probable benefit in a small number of patients in phase 2, since this is dependent on the patient and on the situation. It will be sufficient to show safety only to receive a temporary conditional approval. This will have the effect of shortening period until placing on the market gradually, as I will show later. After this conditional approval, market will be done by accumulating a suitable number of patients for treatment until 7 years. And after obtaining statistical efficacy data during that process, final approval will be made. In the case of heart sheet produced by JETRO in Japan, it is approved as conditional approval, since the efficacy is estimated by 5 patients among 7 patients. On market period, they should evaluate 60 patients treated heart sheet compared with 120 patients treated existing treatment within 5 years. Next, the Act on the Safety of Regenerative Medicine regulates the stipulates 3 risk level-dependent provision standards and procedures. The Act on the Safety and Regenerative Medicine categorized regenerative medicine according to 3 risk levels by safety. Class 1 is high risk, for example, ES cells and iPS cells. Class 2 is medium risk, for example, stem cells such as mesenchymal cells. Class 3 is low risk, for example, processing somatic cells. It was established suitable protocol for the practice of regenerative medicine area to allow quick and effectively response to patient requirements. Moreover, this act enables medical institutions to outsource cell processing. In the previous regulatory framework, medical institutes cannot outsource the processing and storage of cells for clinical study and provide practice in Japan. This new framework enables medical institutions to outsource cell and tissue processing. So a new market for cell processing center is expanded. In Japan, as you know, I think under the previous regulatory framework, 2 regenerative medicine products have been commercialized to data, namely JACE, autologous culture epidermis, and JAS and autologous culture cartridge. Both products are produced by JETRO, subsidiary of Fujifilm, and were evaluated under the previous regulatory framework. So approval took about 5 to 8 years. In the result of new framework, 2 products, one is Thermo and other JCR. 2 products were approved last September. One is autologous skeletal myoblastoid produced by Thermo Corporation. It is conditional approval. The other one is allogeneic mesenchymal stem cells produced by JCR Farm Corporation. It is first allogeneic product in Japan. These products approval took about 3.5 years. This dramatic change and shortening out to the new framework. Some foreign companies has been very active in forming partnership with Japanese companies. They have sourced partners in Japan on the basis that this was the most efficient way to start a business in Japan. For example, Fujifilm has acquired CDI with the aim of improving iPS cell manufacturing. Lonza has cooperated with Nikon, which is famous for optical instruments. They plan to start contract cell manufacturing. In addition, Regenerative succeeded in establishing a licensing agreement with Shiseido, which is the #1 cosmetic company in Japan. Finally, Helios and Asahi agreed that Helios will develop a cell therapy product in Japan. The Japanese government strongly supports the entry of overseas and has established the Invest Japan policy as the highest priority area. Next, I'd like to introduce about FARM. FARM is the largest industrial group of regenerative medicine our mission is dedicated to the promotion of human health through the spirit of regenerative medicine. FARM was established on June 2011. FARM's mission is to accelerate industrialization of regenerative medicine in Japan. FARM is an industrial forum and represents various types of business. We have categorized these companies into 4 groups. The first group represents the core business of this area, such as regenerative medicine and cell therapy companies, as well as biotechnology companies and pharmaceutical companies. Next are machine device company group, the chemical materials group, and logistics and insurance group. These 4 groups each include approximately the same number of companies. To date, a total of 183 companies have joined us. As shown by the structure of our forum, the regenerative medicine and cell therapy industry is built on various technologies and industrial knowledge. To accelerate industrialization in the regenerative medicine cell therapy area and worldwide collaboration, FARM is aggressively promoting the establishment of MOU with embassy and industry association of other countries. FARM signed an MOU with in the US, Embassy of Sweden, and Australian Embassy in last year. CCRM in Canada and the UK BIA will be coming soon. We value the establishment of committed relationships with embassy associations and other groups from around the world as a means of accelerating regenerative medicine cell therapy industrialization. This slide shows the organizational structure of FARM. FARM is organized under 6 management committees and 4 expert committees, shown in the green and blue box at right. First, the supporting industry committee is supporting industry committee in expert committee consists of industries dealing with reagent, materials, device, transportation, and so on. Our business requires a wide range of expertise in highly advanced scientific, technological, and knowledge about innovation. No single industry can cover all of these, so supporting industries play a crucial role in our operation and development. The second committee is standardization committee. To set and adapt global standards, we'd also like to contribute to establishing appropriate worldwide standards regulatory committee. Finally, we have a regulatory committee and a medical economics committee. These committees are also important, particularly with regard to reimbursement issues. In April 2015, we established the Regenerative Medicine Industrialization Task Force of RMIT. I'll show the detail of this group later. Last part of our presentation is about FARM as a hub of collaboration between Japanese April, FAM opened an office to support the entry of foreign companies into Japan for the development of regenerative medicine and cell therapy products. The team is named RMIT, the Regenerative Medicine Industrialization Task Force. RMIT has a business office in downtown Tokyo in Nihonbashi. The office includes an English-speaking leader working full-time to support foreign companies. When RMIT received an approach, contact, and question from foreign companies, academic groups, or individuals, it will support their requirement and introduce them as appropriate to RMIT and FAM member companies. RMIT is trying to partner and collaborate between overseas venture or company with FAM member companies. RMIT members especially hope to conduct partnering with company with regenerative medicine product candidates. If you have a regenerative medicine product candidate, please contact RMIT for entering Japanese market. RMIT has also developed a plan of a new regenerative medicine cell therapy industrialization as a Life Innovation Center in Tonomachi, Kanagawa Prefecture, a little south of Tokyo. And it is really close to the Haneda International Airport. We will build a one-stop service to supply various equipment and needs with an already established high-level made-in-Japan quality for solution for industrialization in the regenerative medicine and cell therapy area. And we have a plan for fostering and promotion of venture companies. We would like to build the birthplace of the regenerative medicine cell therapy industry in this area in Japan. Japanese government will prepare some support to foreign companies, ventures, and researchers for establishing a venture in Japan. If you would like to obtain this support, you should submit an application form to Japanese government or JETRO. RMIT will strongly support for your job. If you would like to collaborate with Japanese company, obtain Japanese support, or expand your market to Japan, please contact us RMIT. This slide shows conclusion. The regenerative medicine market in Japan is attractive. To maximize opportunity, Japanese industries welcome Canadians for collaboration in a lot of business sectors. FAB is a FAB of collaboration. Please contact Regenerative Medicine Industrialization RMIT in FAB. Please contact us for entering Japanese market and collaborating with Japanese companies. Thank you.
So I think now we can take some questions, and I will stand up here as well and take any questions about my presentation. You know, I think you can see by this presentation the bold changes that are taking place in Japan around regulatory approval. The idea of a conditional approval based on very high level of safety, but allowing products to come to market and be reimbursed and get the efficacy data generated while treating patients is very different from what's happened previously, and is very, very specific to cell therapy. I think also it's important to note, and I hope you see in this presentation, how important industry in Japan is playing in driving these changes. CCRM and other organizations like it in Canada were seeded by the Canadian government. In Japan, it's the industry that's actually leading the creation of these platforms, and so there's a lot of complementarity there, but a little bit of difference. So maybe I will now open up for any questions.
So this expedited approval process is something that's only in Japan, specifically for stem cell research.
First of all, this expedited process will be applied only in Japan for both stem cell researches and gene therapies.
Gene therapies as well. Now with pharmaceuticals, do they do this as well in Japan or no?
So there's another regulatory for pharmaceuticals.
Okay, thank you.
Thank you, Mr. Kaki-san. I'm curious about the heart sheet conditional approval. It's the first I'd heard that there was a specification for 60 patients to be treated by heart sheet as a precursor to the final approval. So was that part of the conditional approval decision to decide how many patients had to be treated in the 7-year, or I guess it was 5 years for heart sheet? Is that correct?
心臓のシートについての条件付きのアプローバーについて質問があります。ここで特定でそのコンディショナルのアプローバーで得るためには60名の脳患者さんに対しましてそのハートシートをやるということがそれぞれの考えでありました。でその後最終的な安全性とかが確立された後最終的なアプローバーが結構提供されるわけなんですけれども、このように何名の患者を条件付きの処理のもとで観察していかなければいけないかとか、安全性を確保するということを証明しなければいけないかというその数字、人数に制限があるでしょうかね。それは5年間ですよね、半年もですが、それで最終的なアプローバーを取らなければいけないということです。5年からマックス7年で、人数に関するケースバイケース、それはハートシートに関して、But actually, the number of patients for a conditional approval is still case by case. In the case for heart sheet, the number of patients is 60. And also for the heart sheet patients, the duration for conditional approval is 5 years. But again, it is case by case and it's up to 7 years.
Thank you.
Thank you. Can you explain the relationship between the RMIT, or the Industrialization Task Force, and the LIC? Yeah, I didn't quite understand that. The Life Innovative Center.
Life Innovation Center の関係というのはよくわからなかったですけども、ご説明いただけますか。Actually, Life Innovation Center is the name of the facility or buildings. Within the building, our meet is located.
I wanted to clarify the definition of regenerative medicine. My understanding, I'd looked at some of the things on the Japanese Ministry of Health website. So they talked about cell therapy, they talked about gene therapy, but there was a third category, and it wasn't really clear from what I was reading how that third category fit into the regenerative medicine. So could you explain the definition of regenerative medicine as it applies here?
ここでですね、言われております再生医療の定義というのがよくわかりませんでした。で、私は厚生労働省のウェブサイトに行きまして、そこで定義を見たんですけども、その時に3つカテゴリーがありまして、1つは、セルセラピー、細胞治療、それからジーンセラピーというのもあったんですけども、3番目のカテゴリー、これは再生医療にかかることだと思いますけど、ここがよくわかりませんでした。ということで、再生医療の定義についてお話しいただきます。
And in the presentation, you mentioned cell and gene and also tissue-based products. So that's what we're, does it include tissue-based products and how do you define that?
厚生労働省のウェブサイトの中で再生医療という時に見つかっているセルセラピー、それからジンセラピー、3番目がよく暫定的な翻訳っていうのが載っておりまして、それをよく理解できませんでした。多分ですね、ティッシュベースのセラピーとかそういったことだったと思います。でまた、先ほどのプレゼンの中にもティッシュセラピー、ティッシュベースのっていうのがあったので、そういったことかと思いますけれども、よくわかんないですか。もし可能であれば。Because I do not belong to the Ministry of Health, so I don't know for sure what it intended to write. But if you desire, I can check and get back to you later.
Thank you.
Hi, thank you for the information and presentation. I'm from clinical research background, so I'd like to know if there any support for the enrolling a subject in Japan. I remember correctly that if you have a product in Japan and would like to do clinical research, the subject has to be Japanese, although this person is Japanese background, although born in Vancouver, doesn't meet the criteria to enroll the Japanese clinical trial. If it's correct, then is there any regulation around it, or is there any new industrial definitions coming into place, or could you have any information about this?
まずですね、日本で臨床試験をやっていくためには、その日本人でなければいけないというような定義があるんではないかと思います。ただ、例えばこの日本人であるときに、バンクーバー生まれなんですけども、日本人っていうのも、日本での臨床試験を受ける、資格というのがあるんでしょうか。また、その日本で臨床試験に使われる、患者さんの定義っていうのはあるんでしょうか。特に日本の臨床試験って日本人だけではないです。日本の病院で臨床試験が受けれれば、それで日本の臨床試験で使う細胞も日本人の細胞ではなくて、海外の細胞を今は使って臨床試験をしています。
では、このセル細胞の試験に関してですと、日本人の方でなくても、日本に滞在されている外国人の方が最近かなりいらっしゃると思うんですけれども、その方たちに対しても政府としては援助していくっていう、そういう方向でしょうか。ありがとうございます。
So the answer is for cell therapy clinical studies, subject does not have to be Japanese, but some foreigners these days, many of them staying in Japan, so those foreigners can participate in the clinical study. And also the cells can be the ones harvested in overseas as well.
This is a question that applies to both of you, but in both instances, the governments have decided that it's important to create government-funded manufacturing infrastructure that will compete in many ways with the very same kind of infrastructure that's been created by private enterprise or by existing academic institutions. And I'm curious about what drives the decision to create government funded infrastructure like that versus supporting the existing private infrastructure or academic infrastructure that's already been in place.
これは両者についてのご質問なんですけれども、ここで、両方の組織とも政府がお金を出して、製造するような、構造というのを作ってきていらっしゃると思います。ただ、既存の産業が、主導しているようなもの、あるいは大学のようなところが主導している、組織、同様の組織というのはあると思いますけどので、例えばその政府がやった場合にそこと競合するという可能性があります。ですから政府としてはどうしてその既存の業界あるいは大学がイニシアチブを取っているところをサポートする代わりに、独自のお金を使ってこのような組織というのを築いたんでしょうか。
Would you like to go first?
今では、大学に対しては、文科省がサポートしていて、産業の推進に関しては経済産業省がサポートしています。で、エリア的にはバッティングしない。
in Japan, the ministry in charge for each stream is different. For example, for universities, a Ministry of Education, Sports, Technology, and Science and Technology is providing support. And for industries, METI, or Ministry of Economy, Trade and Industry, is providing support. Therefore, there is no competition in this area in Japan.
I would answer similarly. The basic philosophy of the CCRM Industry Consortium is to enable the industry partners that we have. So the investment that we're making and the initiatives that we're establishing are about filling gaps that don't exist in the industry to enable manufacturing. But I think in both countries, building that expertise locally in filling the gaps that exist in either jurisdiction is about making sure that manufacturing, that both jurisdictions have manufacturing hubs, because manufacturing is critical to economic development and commercialization. There are other organizations in the world that are building major commercial scale manufacturing facilities, and they are being criticized for competing with private enterprise that's just down the street. That doesn't exist in Canada, and we're not doing that. Stephen?
Thank you. So I just want to go back on the question around the clinical trials in Japan and the conditional approval. So did I understand correctly that the product could be, the cell therapy product could be manufactured outside of Japan for the trial and then shipped to Japan and used in a trial in Japan, and that would be acceptable for the conditional approval pathway?
もう一つですね、日本での臨床試験のことに関して質問があります。条件付きのアプローバルということなんですけども、例えばセルセラピーにつきましては、このセルは海外で作ります。そしてそれを日本に輸出して、でそれを使ってそのクリニカルトライアルをやる。そしてこの条件付きのアプローバルをやるといったことができるでしょうか。
今JCR ファーマさんの製品は海外のサイトを買って日本で製品をしている。
Yes, that is possible. For example, in the case of JCR Pharma, they are purchasing cells manufactured in overseas, and then they're using that, they're manufacturing their products in Japan.
Thank you.
In other discussions as I've been a part of, I do think in the long-term commercial production, there is an interest in having as much of that, if not all of it, done in Japan for the Japanese market. But it may be different during the enabling trials in that conditional period. But some of these things are just, I don't think, totally determined yet.
Thank you. So I have another question. So when this product is on the stream of the new approval system, on a conditional approval, how Health Canada would treat the product or IP product as is? Is it something that has to be still on, as a Health Canada point of view, is it still something that is clinical trial on the third or fourth phase, or is it something that Health Canada would expedite their process to approve a little bit faster, or any positions for that?
So I don't have expertise there and certainly wouldn't wish to speak for Health Canada, but we do have people here in the audience that may have a position on that. Anyway, go ahead, if you get the mic. Maybe just say your name and.
Yeah, I'm Patrick Bedford. I work at Health Canada, and I've been working to develop the guidance for clinical trials, and now I'm looking at some of these issues. So this is, first of all, thank you. This has been very interesting, and I'm interested in finding out more how Japan actually applies the system that they've developed. I think I can take your question one of two ways. So just a clarification first. Are you wondering how Health Canada would view the data that's obtained on the market with a conditional approval, or are you wondering if we have something similar ways and what kind of data we need for?
If
if you have any similar thing, then that would be great to know, but my interest was for the first question.
Okay, well, maybe I'll answer it. I'll mention Health Canada has something similar, but I think there's going to be some very important differences, and I'm still trying to understand those. So I'll mention that, and then I'll go into the second one to the extent that I can. Health Canada does have a notice of compliance with conditions that applies to all drugs, and they would include cell therapies. So it's possible to have safety data, promising efficacy data, and meet certain criteria. Those being that it has to be a serious life-threatening or condition, and that there's no other treatments available. You can qualify for a notice of compliance with conditions, which is a market authorization. That would be early, but you'd have to have that safety data, and I think this is where the details might be different. Typically, at least phase 2, maybe some started phase 3 clinical trials. So that's the system in Canada. So there is the opportunity to apply, and Health Canada is available to discuss on a case-by-case basis for when someone wants to apply for that. And then to get to the next question, if there's Health Canada will look at any data that's gathered internationally, regardless of whether it's in a clinical trial that's approved as a clinical trial in the jurisdiction or if it's on the market. The question that Health Canada would focus on is how reliable is the data. And typically with clinical trials, they're very closely controlled, and so there's that automatic, some evidence would be required and questions might be asked, but I believe Health Canada and the reviewers on the policy side, but would be able to trust that data and find it reliable and valid. I think there's some work that can be done to understand better. Japan's an ICH, International Committee on Harmonization group, so the post-marketing surveillance is probably is on par with other respected and well-known regulators. So it would depend on the quality of data that you're gathering in the clinical trial, and Health Canada would have questions about that. Just by virtue, I believe, of the difference between carefully controlled clinical trials and the more difficult scenario of gathering data when it's in the market, because you're relying a lot more on post-market surveillance, even if it is a clinical trial, it's just more broad. So hopefully that gives you an idea, but that's just if you have detailed questions that we can provide some contact information and have a more authorized response. But
thank you for providing that answer and that input. So Canada does have conditional approval too. It's not as formal as this, and it's a case-by-case basis. I think it's their position they want to keep it that way for the next little while. But there are again ways to think of the two, the harmonization of the two regulatory bodies in this cell therapy field. We have now scheduled a break, and I think we should have it. If there are more questions, the next 20 minutes would be a great time to ask them as we have a little break. The point of this break is to do some more networking, we'll be back in 15 to 20 minutes for the next talk. Let's thank our speakers, please.